Hello, good morning, good afternoon, good evening po sa lahat. Welcome to our 106 episode po of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Maraming salamat po at thank you for being part of our credible online community. And to all those who have just discovered us for today, welcome po at sana masiyahan po kayo sa ating topic and for our future topics in our future webinars. There has been a significant rise in COVID-19 cases in European countries due to highly infectious subvariants of Omicron, raising fears of a new global wave of disease, lalo na po ngayon na mayroon pong fear that immunity has been declining and then summer travel has been increasing. You will note that the United Kingdom, Portugal, Germany, France, Greece, Australia, Italy, Switzerland, and Spain, they have all reported rising infections po, no? And some studies have shown that the two new subvariants, BA.4 and BA.5, they are able to evade. Medyo nakakatakas po siya sa immune system po natin and that neither previous infections nor vaccines are providing particularly strong protection. So for our today's webinar po, we would like to ask the question, COVID-19 surge in Europe, susunod po ba tayo? I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday po, no? And always look forward to Fridays because again, kasama na naman po natin siya, my beloved mentor and also she's a international public health communications expert, but also our adjunct research faculty at the National Telehealth Center. Dr. Susie Pineda Mercado. Partner, we missed you, partner.
Hi, good afternoon, Raymond. Magandang hapon po sa inyong lahat. San man kayo naroon, I hope you're all doing well. And I did miss you, Raymond, as well as our usual group here in Stop COVID Deaths. Na-miss ko rin kayo. Siyempre, I was able to watch a small part of it when I was traveling, pero nawalan din ako ng internet. Anyway, magandang hapon po sa inyong lahat. And welcome to everyone who's watching on the playback, watching on YouTube, Facebook, welcome po. No? Napansin natin, Raymond, maraming nanonood ngayon sa Facebook tsaka sa YouTube. No? So binabati ko po yung lahat. Stay with us. You can also interact with the program even if you're on Facebook and YouTube. So we like the interaction, and you'll notice we said COVID. We haven't changed the title. It's still Stop COVID Deaths, but we say C refers to current COVID-19 problems. And like today, we will talk about current COVID-19 problems. In fact, ito nga yung sabi ni Raymond, dumadaming mga kaso sa Europe. Ang question kasi dyan epektibo ba yung bakuna? Diba? So we're gonna talk about how effective vaccines have been in other parts of the world as well as in the Philippines. And then O for other outbreaks, V for viral infections, I for other infections, and D for disasters. So stop COVID deaths pa rin tayo, pero in-expand po natin ng konti ang ating mga pinag-uusapan batay rin doon sa mga hinihingi nyo o hinihiling yung topic. No? So anyway, we know that you all want to be updated on recent developments on the news, both here and abroad. And so it's for this reason that we bring you a new segment called the News Update. Okay, binabantayan po natin sa news ngayon. Ay, nawala yung... Sorry. Binabantayan po natin sa news ngayon itong two things. We are looking at the banning of Juul, which is a form of vaping, and we are also looking at I have some news on menstrual health. Actually, marami sa mga kababaihan, no, they can't afford sanitary pads. And a lot of kids, actually young girls, are not able to go to school. They miss so many days of school because when they're having their period, there's no place to change and maybe they don't have napkins. So let's watch this news clip.
India grows more bananas than anywhere else in the world. But about half of each plant goes to waste. One company is turning that waste into biodegradable sanitary pads. that could help more people have safer periods. With disposable plastic pads on the rise, can banana stems save the country from mountains of trash?
So that's our news from the Insider. 1 in 4 women in India don't have the supplies they need for their period. One startup is turning farm waste into biodegradable pads that could prevent the mountains of plastic trash that conventional pads create. To some other news, let's turn over to Raymond.
Okay, thank you so much, Dr. Susie, no? There has been really a lot of work that has been done with regards to yung mga smoking cessation po, lalo na po patungkol sa banning of certain products. Did you know na yung US FDA po, they have ordered Juul to stop selling e-cigarettes. So it is, I would say it's very monumental po in the sense na talagang there's been an active contribution with regards from the FDA on how e-cigarettes po talaga are not helping the cause. 2 days ago, there's been a news po that Juul seeks to extend the stay on the FDA ban. Kasi syempre nilalabanan nila yung ban po, no. Ang contention po nila, the US FDA did not evaluate all of its evidence. So we all know that FDA, they have banned the sales of Juul e-cigarettes po nitong nakaraang linggo because of lack of sufficient evidence regarding the toxicological profiles of the products. However, there has been a court that granted Juul's request. Ito po yung kumpanya na nagbebenta ng e-cigarettes for a temporary stay. Ibig sabihin, they have been given a reprieve. Immediately, the next day, nag-apply po sila for a reprieve and they were granted that para makapag-continue pa po sila ng pagbebenta. Juul has filed for an extension of that stay or reprieve just because they argue that the FDA did not review all of its evidence. So it really is an evolving news po, no? But I think there might be implications as to the trickle-down effect from the United States as well as other countries, lalo na po sa ating bansa, wherein, syempre, you will know that meron pong mga vaping shops po na talagang that have sprouted all throughout the urban areas specifically. So that's something that we should keep an eye on. And that's the news update for this week.
Well, Raymond, before we leave that topic, no, actually, all these vaping shops need to be banned and removed. No? Vaping has really been shown to be a gateway for smoking, and it's quite dangerous, and it's actually very addicting. No? So anyway, I'm happy to hear that news, and I hope that the filter down will be greater regulation in the Philippines. That's our news for today, and we'll continue to update you on our news update. Okay, partner, balik tayo sa ating topic, no? Naguguluhan ako mag-change ng background. Sorry, Dapat, Raymond, ikaw yatang mauna. Nakita tuloy ng audience yung aking kwarto. Ang gulo-gulo. So anyway, balik tayo sa topic natin, no? So, what's happening, itong dumadami yung mga kaso ng COVID sa Europe, dapat ba, ano ba ang tingin natin mangyayari dyan, no? And we always start also with some voices of people on the street. So Raymond, let's cue that.
Thank you so much, Dr. Susie. And for all those who are joining us for the very first time, we always start our discussion by setting it into context by taking the pulse of the common person on the street po, which we call the person on the street videos. For this person on the street video, we post the question, dumadami na po ang COVID-19 cases sa Europa. Ano po sa palagay ninyo ang mga susunod na mangyayari? Please watch this.
Kung gaano kasi nababalitaan hindi ko nakakakita.
Sa ngayon po sir, wala po akong balita kasi sir, hindi naman ako masyado nanonood ng TV.
Siguro maraming maapektuhan ngayon sa Philippines kung may surge sa Europe kasi lalo na meron ng ongoing war, then dadagdagan pa ng surge ng COVID cases.
Maapektuhan ang hanap buhay, lalo na sa amin. Tulad dito, may trabaho kami, mag-apektuhan kami.
Sa tingin ko naman po sir, siguro, COVID naman siguro, hindi naman talaga din parang na lang din, parang lagnat lang din sir, trangkaso, ganun.
Ay, talagang magkakaroon tayo ng search na galing sa Europe kung hindi tayo marunong maghugas ng kamay, mag-face mask, at magkaroon ng social distancing.
Kasi kung paano, ang pinaka-importante diyan kung paano siya i-handle ng government natin eh.
Siguro pwede natin i-take yung suggestions ng mga tao, most specifically sa social media kasi doon naman pinaka malakas yung boses ng mga tao sa social media.
Depende siguro sir, pero sa tingin ko sir, ang COVID kasi sir na parang lang sir, sa pangkaraniwang sakit lang sir, kasi pag mayroong nakaramdam ng ubo o lagnat, trangkaso, iniisip na kagad ng tao na COVID na po. Pero para sa akin, pangkaraniwang sakit na lang po yan sir, hindi na dapat katakutan.
Since na-experience na natin siya before, mentally, siguro prepared na yung mga tao, alam nila yung gagawin.
Higpitan ng yung mga paliparan para hindi na makapunta yung sakit na yun na galing doon sa atin, ay galing doon, para hindi mapunta sa atin dito.
Inspection pagdating sa airports, kung yung mga pupunta dito sa Philippines na galing Europe, siguro mas maging strict pagdating sa health protocols.
At lagi tayong mag-iingat pa rin, huwag masyadong pabaya. I-practice pa rin natin social distancing. Tsaka lahat naman gusto na bumalik sa normal, pero kailangan pa rin natin mag-ingat. Siyempre mahirap na, lalo na naghahanap buhay tayo.
Okay, thank you very much, TVUP. It's always great to hear what people are thinking about what's going on outside of the country and in the country. And nakikita naman natin, Raymond, na parang nakadikit na sa kanilang health protocols, ano yung mga kailangan gawin. But of course, I think particularly in our episode now, we want to talk a little bit more about what could protect us from this new subvariant. So over to you, Raymond.
Thank you so much, Dr. Susie, and thank you to our TVUP team, production team po, for that something to think about with regards to how people on the ground are really considering this news, and maybe there's a little element of anxiety also for that, kasi baka syempre iniisip nila babalik tayo sa mga nakaraang alert levels po natin, no? Anyway, a little bit of housekeeping for all those who are asking, lalo na po sa mga nagme-message po sa Messenger at saka sa sa email na stopcovid@up.edu.ph. Certificates of attendance will be given to those who have watched at least 50% of the webinar duration. We have already sent out for webinars 1 to 104. Mayroon pa rin pong paunti-unti na hindi pa po nakatanggap for webinar 105, pero napakakonti na lang po iyon. So if you believe you should have received something but did not, please email us at stopcoviddeaths@up.edu.ph. For today's webinar, we will be again following our standard panel discussion format, having the speakers present, and then there will have a set of reactions po, no? Sana po ay masiyahan po kayo sa ating lively discussion that will be followed by a Q&A session wherein we'll be choosing questions coming in not just from the Zoom but also in Facebook and in YouTube. So if you have any questions already, please put them in the Q&A box here in Zoom, and then if you are in Facebook or YouTube, dun lang po sa comment section. Meron po one of our teammates will be scanning those platforms po, so to be sure that we could get your questions. Dr. Susie?
Oo nga, kasi Raymond, yung balitang kumakalat sa Europe is yung subvariant ng Omicron, no, na BA.4 tsaka 0.5.
Right.
So we'll talk a little bit about these things, talk about how effective our vaccines are here in the Philippines, and of course we're going to get some feedback from PGH and from the Department of Health. But before we proceed, we have a fun quiz.
Correct. Can we have our animation?
Intro. Hello.
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Okay, thank you so much. Can we also have it not just on Slido but on Zoom, the poll question po? I'm not sure if it's opening up for direct. There we go. Okay.
Yan na.
We
Okay.
have 2 questions po dito, no? But for those who are outside of the Zoom, you can obviously still join us for this fun quiz. If you go to your browser, buksan nyo lang po iyon, go to the address bar and then type in slido.com, and then when you're prompted, you input the code 5405717. That's 5405717 for you to be able to participate. The 2 questions that we have are, number 1, the BA.4 and BA.5 subvariants belong to which COVID-19 variant? Is it Omicron? Is it Delta? Or is it Lambda? So, yun po ang ating mga what do you call this? Ang ating mga variants na meron, but BA.4 and BA.5 are the sub-variants for this variant. We'd like to greet, obviously there are those who are in the call po we have already greeted, but we'd like to greet those who are joining us from the Lorma Medical Center, San Fernando, La Union, Rizal Provincial Hospital, System Annex 2 in Antipolo, Rizal, Philippine Institute of Certified Public Accountants in Makati City, Cagadas Medical Clinic in Catarman, Camiguin, Southern Philippines Medical Center in Davao City. Locally po, I think there are those who are joining us from FEU and RMF. Maraming salamat po from UP, Diliman, from Davao, sa Pagcor po ng Davao. Also in the call, there are those from West Visayas Medical Center, RPHS Annex 1 Antipolo. Thank you so much po sa inyo. Obviously, we have our regulars po coming in from the Schools Division of Isabela. Thank you so much, Joseph Ermitanio, for always putting in, especially yung pong colorful po ng mga icons in the chat. So, maraming salamat po. There's also ZCMC from Zamboanga City. So, thank you so much. Question number 2. Are the BA.4 and BA.5 subvariants causing COVID-19 surge in Europe? Medyo na po yun pabigay na po yun nakasagutan. Anyway, there are only 2 answers. Is it yes or is it no? And you all know that we are also being viewed internationally, so we would like to greet our international audience joining in from Chonin Hospital in Taipei, Taiwan, Canto City in Vietnam, King Fahad Hospital Medina in Saudi Arabia, the University of Fa'il also in Saudi Arabia, Doha, Qatar. Our attendees from Lunichi Ali University of Blida 2 in Algeria, from Huntington Beach in California, and then lastly, the St. Eustatius Auxiliary Home Foundation in Oranjestad, Netherlands, Antilles. We will not be closing our fun quiz po. No? We all know that marami po talaga ang gustong sumali as we move on to our webinar proper. Dr. Susie?
Yeah, thank you so much, Raymond. And thank you everyone for participating in our fun quiz. Mamaya malalaman natin yung tamang sagot dyan. No? So let's go to our webinar proper. And, in our first announcement, we had invited somebody who had been on the show before, Martin HIBBERD of the London School of Hygiene and Tropical Medicine. However, as he was traveling, sumama yung pakiramdam niya, no? And we're noticing a lot of people who are traveling are beginning to feel not well. But the good news is our main speaker for today is fine. And she just came back from London. And we will talk muna before she gives her presentation. Kilala niyo po ito, no? At paborito niyo. Siya po ang head ng Hospital Infection Unit ng Philippine General Hospital. We would like to welcome Dr. Regina or Nina BERBA. Nina, welcome.
Hello everybody. Good afternoon po sa inyong lahat.
Oh, Nina, kamusta sa London? Kamusta ba? Kamusta ang Queen?
Yeah, the Queen. Oh, hindi ko siya nakita pero nakapunta lang ako dun sa kanyang castle. So it was
nakapunta ka sa
really
Quezon.
lovely.
Oh, ang daming hearts, Nina. A lot of people look forward to listening to you because you've always been a sort of calm and soothing voice and explaining to us how PGH has been able to contain infection at the hospital level. But Nina, was there a lot of talk about increasing cases in the UK when you were there? Yun ba ay issue sa kanila or balita lang yun at hindi naman pinapansin ng tao?
Oo, parang ganun nga ang feel, Susie.
Parang wala lang.
Parang so it was a shock to me. Pagbaba mo ng underground yung tawag sa subway doon, di ba? Pagbaba mo, wala nang nakamask. So people are not keen into wearing their masks anymore. So sa airplane, yung flight from Manila to London, very strict pa yung Qatar eh. I rode Qatar. Tapos very strict sila. Kailangan naka-mask the whole time. Tatanggalin mo lang pag kakain ka. Tapos even sa airport ng Doha, ganun din. So I was sort of like relieved na, oh sige, okay yon. Pero when we went down sa London, talagang medyo na-culture shock ako na people weren't wearing their masks anymore. All the way from yung immigration, yung ganun. Wala na
Wala na talaga, parang wala lang. Oo.
Parang wala na. So I went there actually to attend meetings for research with the people from the universities in Europe. So mga kasama ko, mga infectious disease professors, yung ganyan. So, medyo nakamask pa ako pagpasok ko eh.
Pero sila hindi sila
nakamask. Parang even them, hindi na sila nakamask. They said parang the meeting was really about COVID-19, but we were really talking about long-haul COVID, mga complications of COVID, not anymore maybe into the main meat, yung mga, parang to them, parang tapos na siguro most of the problems with COVID-19. We're trying to deal with the complications and the long-term chronic complications.
Long-term na. Well, that's interesting, Nina, no? Kasi parang I think you'll be talking to us about vaccine effectiveness. And I think a lot of the confidence or maybe overconfidence, even here in the United States, no, comes from the fact that there is a vaccine and the vaccine is readily available. So I think in your talk, you will be talking about your studies on vaccine effectiveness. And I think that sort of also answers our question a little bit. No? But I think in our discussion, we'll talk about that. No? So dumadami yung cases and yet, parang in other parts of the world, they're not doing that anymore, yung mga mask, no? Hindi na.
Oo, they've really declared that restrictions have gone down. So, for example, I stayed in a dormitory kasi close to the university. So when we went there 1 week before the end of June, may rule pa sila na dapat may COVID swab ka, negative dapat. When you go around the corridors of the dormitory, dapat nakamask ka. But by the end of the week that I was there, nilift na yung restrictions. In-announce nila na, starting this day, hindi na kailangan mag-mask even inside the dormitory. So medyo confident sila. I think the numbers are increasing, pero not to the extent of what it was before. So they were saying before, nasa mga thousands, kunyari 4,000 to 5,000 deaths over the winter months last year. Pero ngayon, nasa like in the hundreds only, mga 400 to 500. Of course, concerning pa rin siya, but not to the extent as before. So people are really relaxing in terms of restrictions.
Yeah, okay. Well, sige, Nina, go ahead with your presentation. We're eager and our audience has been waiting to hear from you on your latest study on vaccine effectiveness, which I think is really very much linked to the question of kung dumadami sa ibang bansa, dadami din ba dito, no? At kung dumami man dito, dapat ba may pangamba tayo? Sige, go ahead, Nina.
Sige. So I'll be sharing my... Okay. So, please give me about 20 minutes to talk about vaccine effectiveness. This is the first report that will come out from the Philippines on vaccine effectiveness. This is our implementing agency in UP Manila, and the sponsor is the DOST. So medyo ganito yung outline ng aking talk. And I'd like to start off saying na really this COVID-19, I'm sure alam na natin ganito yung numbers. Each time I update this particular slide, talagang by the 100 millions siya dumadami each time. No? So this is our numbers, global numbers as of yesterday. More than 6 million deaths worldwide. And really, we think that the vaccines may be the key to the end of the COVID pandemic. So yan ang key message natin. It's really through the vaccines and all the other efforts, but mainly through the vaccines that we will find the end to this COVID problem. So this is the situation in the Philippines. And it's true na may konting increase, no? And that's sort of keeping us more vigilant. 2.6% positivity about 2 weeks ago, and now it's up to mga 6 to 7%. And this is our vaccination accomplishments as of the other day. Ang mahalaga dito sa slide na to, yung booster doses, parang ano lang, 20% ng number of people who actually completed the primary series. So 14 million versus the anticipated 70 million. So parang meron pa tayong space to improve. And hopefully with this presentation, parang those who have not been convinced that boosters are necessary would go ahead and line up dun sa mga LGUs to get their booster shots. So this is about vaccine effectiveness, and just to give an overview of the difference between vaccine effectiveness and efficacy. Yung efficacy kasi, it's a term we used when the numbers are coming from very controlled clinical trials versus a vaccine effectiveness study, which we are doing. Parang sinasabi natin, ito na yung nangyayari as we are seeing it, real world setting. So lahat na ng mga different factors that you are maybe unable to control are keyed into the results. So bakit mahalaga to do a VE study? Because it will help us estimate protection over time, see the effectiveness against the different variants, and provide basis for booster recommendations. So what is our project all about? It's really to estimate effectiveness of the vaccines as used in the Philippines. Alam nyo, hinihintay ito ng maraming countries kasi tayo yung parang marami tayo talagang ginamit ng mga Sinovac and other vaccines, particularly Sinovac. And yung mga current reports on vaccine effectiveness from, let's say, Israel, United States, and European countries, they don't have experience with the vaccines that we have used. Okay, so this is the statement of the general objective. Tapos we have a lot of more specific objectives, and I will describe them to you as I move on. So parang dalawang mini studies to in the overall VE project. We're doing a COVID-19 surveillance, looking at how people are doing, nagkaka-COVID ba siya o hindi? Pag na-vaccinate o hindi? At saka, pag na-vaccinate, what's the antibody response? So that's the immunosurveillance part. And while I will just give the results from PGH, we're actually really working on various sites in the Philippines. So iba-ibang setup. So meron kaming inumpisahan sa health facilities kasi dyan talaga nag-start yung rollout ng vaccines. And then we have communities like the UP campus in Diliman and Taguig LGU and Bacoor City. And then workplaces like the Philippine National Police as an example of a government agency, and the San Miguel Corporation as a representative of private companies. So yan mga samples of workplaces. We'd like to see how the vaccines affected those who are vaccinated and how our unvaccinated colleagues who opted to remain unvaccinated did anyway through the COVID pandemic. So all of this is voluntary participation. We wanted to see how the vaccines did for different subgroups A1, A2, A3, A4, and for the different kinds of vaccines. So more or less, parang ganito yung parang design and study. We chose different kinds of sites. We call them cohorts, no? And then observe cohorts through the year. Tinitignan sino nagkaka-COVID, sino nagkaka-symptoms, ano nangyayari sila, nag-hospitalize ba sila, and what are the outcomes. And then simultaneously, we asked for volunteers to provide blood draws for antibodies. And recently, we added T-cell response. May mga talagang mga brave people who agreed to be subset 2, so mas madalas yung blood draws nila. So now we're ready to report the interim estimates of vaccine effectiveness of Sinovac and AstraZeneca for PGH, no? Over the past year. Kasi nga nag-start yung rollout on March 1 of last year. So we ended this particular cohort on February 28, marking 12 months of observation. So there are 2 cohorts kasi when we actually started the study, parang ang plan lang was to see how they would do over a year after the primary series. No? So 2 doses for most vaccines. But along the way, there was that concept of the booster. So we had to divide the groupings into March 1 to November 30 for the first part. So ang tanong dyan ay, may difference ba kung nagpabakuna ka o hindi ka nagpabakuna? And for the second part, from December 1 to February 28, may difference ba kung nagpa-booster ka or versus no booster? So I'd like to just say that the experience of PGH mirrored what was happening in the country. So dyan sa graph sa ilalim, we saw that we've been through 3 surges in the last 12 months. No? So may alpha beta around March to April of 2021. Tapos nagka-delta surge no mga August, September of 2021. And of course, the very memorable Omicron last January. So ganun din ang nangyari sa PGH, no? Parang the same time that the communities and the countries are reporting these surges, the same numbers have been seen with the healthcare workers inside PGH. So in that context, pag-usapan muna natin, may difference ba kung magpa-vaccine or no vaccine? And this is our results. No? So this is vaccine coverage for PGH, total cohort of 5,560. So through the months, parang nag-move on kami from an initial 12.6% take lang up to 96.1% by the end of November. And this is how the different vaccines were taken. So ang unang in-offer was Sinovac, and then through the months, other vaccines were also offered, AstraZeneca. And that's the yellow, the AstraZeneca. More people actually opted for AstraZeneca, 58% versus 31% na Sinovac. But they were the mainstays. Almost 90% of our staff received either Sinovac or AstraZeneca. And this is the characteristics of the of our staff. So mas marami palang females sa PGH, no? 58%, and relatively a young population kami. The mean age was 35 years old. There were a few over 60 years old, and that was good. And as I said, most people received either Astra or Sinovac. So what happened to all of us in the first 9 months? No? So ganito ang nangyari. With the vaccination, this is what happened to us. No? So the large rise no March, April was actually because of the alpha beta kanina, we said the surge. But during that time, very, very few people had complete vaccination. So, but on August, September, many people were actually already vaccinated. And despite that, with the surge, there were still a number of staff that ended up having COVID-19. This one is a very busy slide, pero hindi ko siya ma-transform into a simpler, friendlier picture. But I wanted to show you that, so the second column is all PGH employees, tapos sino yung nagka-COVID, tapos yung third and last column was sino yung breakthrough COVID, nagka-COVID despite being vaccinated. So look down at the bottom row, nakikita nyo dyan na yung marami sa staff actually, 63% of our staff ended up being assigned to a COVID ward. No? Kasi whether you were a nurse, a doctor, support staff, janitorial, nagkaroon ka ng frontline work kasi nga we were a COVID referral hospital. But you would see na hindi totoo na dahil PGH kami at naging COVID referral, ay sigurado magkaka-COVID kami. And you would see that in the last two columns, actually nag-flip yung proportions, no? The ratio and proportions of individuals who had COVID. There were actually more people who had COVID who were actually assigned who never entered a COVID ward. They were assigned to non-COVID areas of the hospital. So that's sort of like demystifies na tanggalin na natin yung myth na pag nagtrabaho ka sa COVID hospital ay surely magkaka-COVID ka. And then the breakthrough infections, the concept is nabakunahan ka na, lumipas na yung 2 weeks, so you're supposed to be fully immunized already. You had a take already of that vaccine, and yet you developed COVID-19. And this is how it looked like. So the darker brown lines are all COVID, and then the lighter ones are the ones that represented breakthrough infections. So nung umpisa parang puro all COVID na unvaccinated individuals, but later on there were still COVID despite vaccination. Among those who had breakthrough infection, so nagka-COVID kahit na nabakunahan na, you would see na most are really mild, 88%. No? And the little squares here represent those who had the more severe kinds of COVID. Only 1% and only 0.5% had severe or critical COVID. So much, much, much less. And the need for hospitalization among the staff who had COVID after vaccination, very few were hospitalized. Most nga kasi mild remained in their homes. And the outcomes, so among those who had COVID, we divided them sa unvaccinated and vaccinated. And you would see na, unfortunately, we had one staff who died and turned out to be unvaccinated. But all vaccinated individuals recovered. So yung vaccine effectiveness, this is how we computed based on WHO guidelines on how to compute. Parang it translates to something like this. Yan. We used person days, no? So hindi individuals, hindi over the number of individuals. We had to break down, let's say if ako, ilan days ako unvaccinated, na ilan days ako naging partially vaccinated, and ilan days ako naging fully vaccinated. Kasi that's how it should be. Okay. So you would see na when we computed incidence rate per 10,000 person days, among unvaccinated, it's the highest incidence rate, 9.62% versus 5.81 among those who completed the vaccine series. So parang half. So let's go now to vaccine effectiveness. So how effective were the vaccines? Okay. So for all kinds of COVID, whether mild, moderate, severe, yan, ito yung protection. 9.5% kung naka-receive ka ng isang dose at 39.6% kung naka-receive ka ng 2 doses. So parang ang baba, diba? But when we compared it, so that's similar to what is reported by other countries. But when we went to more severe kinds of COVID that led to hospitalization, you would see that after 1 dose, there was a vaccine effectiveness already to protect us from hospitalization of 63.2%. And after complete vaccination, complete series, there was a protection of 73.7%. So we're very close to what other countries are reporting. For severe or critical COVID, protection was 85.1% for 1 dose and 82% for complete dose. And for death, dahil isa lang yung namatay sa aming center, and none among those who received even at least just 1 dose, the effectiveness was 100%. So parang very good, no? We compared Sinovac versus AstraZeneca. For all kinds of COVID, parang merong slight difference, no? Pero magkatulad naman sila. But again, for more important outcomes like hospitalization, let's go to yung naka-receive ng complete doses. So for Sinovac, the vaccine effectiveness was computed as around 63% versus 80% for AstraZeneca. For severe to critical COVID, 70% versus 94% for AstraZeneca. Daming numbers, no? Pero tignan nyo na lang yung mga trends. At saka, again, for Sinovac and AstraZeneca, for death, 100%. So parang it sort of affirms us that we're on the right track. Kahit na quote-unquote Sinovac lang na-receive natin, we did get the protection we needed. No? And when we adjusted for age and sex using the Kaplan-Meier graphs for survival, ito yung itsura niya. So there is a distinct protection that fully vaccinated individuals received after full vaccination. Okay. This one is a more interesting part and it's sort of very attractive pag tingnan mo. So ito yung antibody levels. No? So if you remember, once upon a time when I guested here like a year ago, we said na just yung nag 1-year anniversary na kami in PGH, how effective were the things we were doing to protect our healthcare workers. And we found out there na kahit na 1 year na kami frontliners, there were 74% that never got sick. Yung nag-antibody level, non-reactive pa rin sila. So we're very proud of this particular graph. And it is in this background that we started vaccinating people. So we had to understand na may mga tao talaga na nagka-COVID na, so their antibody levels will be a little bit different from those who never had COVID before. So initially, we used the Roche test for IgG, total IgG against SARS-CoV-2. So the brand is Alexis Roche. And initially, para meron rin kaming context, we got samples from unvaccinated healthcare workers and looked what their numbers look like. So here, kita nyo, yung blue tiny little bar represents people prior to vaccination and never had COVID before. Talagang halos walang antibody level. And that's to compare with people, ito yung orange bar, who already had COVID, parang meron na silang a little bit of investment, no? Nagkasakit sila, so they already developed some antibodies, IgGs. Okay, so that's how it looks like when you're unvaccinated. When people are now vaccinated, so the numbers in the bottom represent the weeks post-vaccination. So medyo iba-ibang tao to. So we got 2 samples lang per individual. But you would see that over time, talagang bumababa pala, no, yung antibody level natin. But the numbers are very high. Remember, initially, kung unvaccinated ka, almost 0 ka. But in this the international unit level for the total IgG once you're vaccinated, whether you had COVID before or never had COVID, talagang tumataas. But somewhere along the way, bumababa rin siya, no? Starting around 12 weeks to 24 weeks, parang naghihingalo na yung antibody level natin. So that's around 3 months to 6 months. There's a little bit more durability. So yung orange bars here represent people who had COVID in the past. So mix the COVID infection and the vaccine, matataas rin talaga. And seems to persist over time. This is how Sinovac looks like, no? So minsan, di ba nakakatakot kasi pag-return sa'yo na result, oh no, I'm very close to zero. So that really looks like this. So the Sinovac response, the IgG levels, as expected, because this is an inactivated virus, there seems to be a different, it's postulated that there's a different immune response other than IgG that is helping the people given Sinovac. But just that we know, measuring IgGs looks like this for Sinovac recipients versus, and the orange bars represent Sinovac plus a history of COVID infection. AstraZeneca naman, so mas higher, no? So they reach somewhere more than 1,000 IU levels, and the drop is a little bit less gradual, yung drop over the months. Okay. And we also had some samples from other vaccines, pero mas konti kaya we didn't go into a lot of details on them. Pero you would see na, for example, yung light blue, which represents Moderna, parang consistently mataas siya, no? More than 2,000 international units. Parang ang sarap magkaroon ng Moderna, hindi bumababa. But yan, that's how different vaccines look like. We're trying to increase the number of samples here so we can do the same as we did for Sinovac. Comparing antibody response according to age, so we divided the people who had the antibody tests among those who were more than 50 years old and those who were less than 50 years old. Parang no difference, no, in the median and in the ranges of their antibody levels. We also looked at age and the brands, again, whether you received AstraZeneca, whether you're older or younger, mukhang the same. And the same with Sinovac, no? Parang no difference in terms of age. We also looked at the effect of gender. May difference ba kung male or female response mo to the vaccines? Parang wala din. So the graphs look very similar whether you are male or female. And whether you received AstraZeneca, male, female, tsaka Sinovac, male, female. Okay, so yun, that's the first cohort. We tried to see what kinds of variants we actually experienced. So we sent 144 samples for sequencing to represent PGH data. And you would see here na talaga naman, no? So we saw alpha, beta in March, April, and changing to Delta variants in July, August, September. Okay. So during the Delta surge, I'd just like to again reiterate na during these kinds of surges, talagang we need to get a grip of our exposures, particularly in the community and even within our family. We need to protect ourselves within a family setting. So protect all. At saka, because this is a workplace and personnels are very important, we also needed to control factors that lead to increase exposures within the workplace. So we took care of patient exposures, but also took care of exposures with sick colleagues and what to do with household members who were exposed to other people in their families or communities. Okay. Ito naman. So yung next part, may difference ba kung na-booster? So parang given na dapat magpa-primary series na we try to reach, nung natapos na yung November, 96%, we tried to reach as many as we could para we'll reach close to 100%. Pero talagang, I think, impossible. I think we reached something like 98+%. So, and the next part naman is booster. Dapat ba magpa-booster? So this is the take of boosters among healthcare workers in PGH. No? So in the first month, medyo konti, we weren't sure, pero through the months, lalo na nagka-Omicron, everybody just agreed to have boosters. No? So the booster vaccine that PGH received was the Pfizer brand. Some people opted to have something else outside of PGH. Okay. And here, gusto ko lang pakita sa inyo na talagang sobrang heterogeneous mix yung combination. I think this actually really added to our protection. No? This worked to our advantage. Siguro litong-lito na talaga yung SARS-CoV-2 kasi iba-ibang klaseng combinations of primary series plus booster that they received. People receive. So wala na siyang mapupuntahan. Everybody was just immunologically strong. And this is how we experienced the surge. No? So there was really a rapid rise during the first 2 weeks of January, and then a rapid drop also. And then when it seemed like everybody was boosted already, there were hardly any COVID-19 anymore. This was the characteristics. Again, ang gusto kong zoom into here is the severity. No? So different from the other variants, the Omicron actually always had some mild symptoms. No? Mild pero panay meron. So 99.5%. Actually experienced some kind of symptoms. So only 5 ended up as being classified as asymptomatic, or 0.4%. But really, in the Omicron, mild pero merong symptoms. Here, the outcomes were very, very mild. Wala na halos severe and critical. Only one had moderate, and all recovered. There were no deaths, whether boosted or not boosted. So for the vaccine effectiveness, we could only measure all kinds of COVID kasi wala nang hospitalization, wala nang severe, critical, at walang deaths. So 0 lahat, 100% ang vaccine effectiveness dun. But between no booster and booster, the vaccine effectiveness was 23%. And how did we interpret this? We felt that this was in addition to the vaccine effectiveness of the primary series. This is how it added up. And when you translate that to number needed to vaccinate, or relative risk reduction, translating to manpower needs of our hospital, it really made a difference. Okay. Tapos sa immunosurveillance, this is very, very interesting again. Here, we already used the neutralizing antibody test. So we had access to this better test even. And what we saw was whatever you received before, whether AstraZeneca or Sinovac, the Pfizer brand just really led to very, very high antibody levels, close to 10,000. No? Pero again, parang may rapid drop. No? So through the weeks, here we only have until 4 months after the booster. Kita nyo, rapid drop. Kaya the healthcare workers in our hospital were encouraged to have the second booster. Okay. And again, sa Sinovac, no? Even if you kanina, di ba, we saw the numbers, the IgG of Sinovac was very low. But with the Pfizer, it really boosted it up very high. One of our fellows actually did mathematical modeling of the effect of the booster to the total IgG. So again, regardless of what you had in the past, basta nagpa-booster, tumataas yung IgG. Again. And in terms of genomic sequencing, we actually submitted 167 samples to the PGC, and all of them came back as BA2. Okay, so to summarize, again, our findings mimic what was happening in the country. Even if we're actually a higher burden type of setting, our coverage is 96.1% by the end of November for this primary series and 75% for the booster as of the end of February. And this is the vaccine effectiveness. For the more severe outcomes, it's somewhere between 60% to 100%. So that's very reassuring. We felt that there was adequate vaccine effectiveness for healthcare workers, and it gave us the protection we needed against hospitalization, severe forms of COVID-19, and death. And boosters gave additional protection. Okay, so this is very significant. The study gives us a better understanding of the vaccine effectiveness, will probably guide policies and contribute to ending the pandemic. Pero kailangan talaga ma-boost yung boosters. Kasi yung konti pa lang nung nagpapa-booster. There were many challenges in doing this study. So the whole concept of boosters was not in the primary protocol. There were a lot of some challenges doing the studies in the communities. But siguro kung invite nyo kami ulit in the next few months, we will have more data from more sites across the country. We do get a lot of inspiration from all the support from government and from the private and public partners. Sobrang excited lahat ng tao pag pinapakita namin yung mga antibody tests nila. So thank you to all the teams and all the volunteers. Laki-laki ng team. And we're really moving forward and trying to harmonize the databases that all our other partners. So these are the other sites that we're working on already. And there's a phase 2 of the study that we actually welcome, students, residents, fellows, consultants who really want to work with us. And for you who are watching us, if you have any way of getting into one of these sites, we will be happy to welcome you and your participation. Yun. So stay safe. And for any queries, you can email me. Thank you.
Oh, thank you. Galing talaga ni Nina. Nina, ang galing talaga. Oh my goodness. I'm watching and I'm enthralled by it, and I'm gonna watch it again, and you can see all the hearts, the clapping, and all of that coming out. Iba talaga pag very well. Itong palakpakan na. And thank you, Nina, for Stop COVID Deaths being the first time you presented this data. No, kasi it can be viewed again on YouTube, and I was just mesmerized by your data. I think, as you said in the end, there are so many implications for policy and for how other hospitals and health facilities can protect their health workers. While your data was mainly about PGH, kung lahat ng hospital natin merong ganyan, di ba? Makikita talaga natin na, they don't have to do the study. I think they can just follow based on your recommendations, and that will be a big help for all our frontliners. So, saludo classmate, ang galing mo talaga. Talagang grabe talaga si Nina.
Thank you.
Sige,
and
okay.
Yung mga hearts.
Ang cute, di ba? Para sa iyo yan. Our audience really appreciated it, and watch it again, no? Kasi ang ganda, parang sabi ko, napaka-detailed, ang daming, mahirapan si Stella mag-summarize nito. Okay, Raymond, over to you. We have 2 reactors who are also your favorites. So go ahead, Raymond.
Thank you. Thank you so much, Dr. Nina. Impressive work po dun sa ating analysis and thank you for sharing. We'll see you again at the Q&A, ma'am. We'll just have two reactions po from our two other guests. So for our first reactor, he is a pulmonologist and also the head of the critical care unit of the management action team at the Philippine General Hospital. You already know him. You've seen him before. He is Dr. Jubert Benedicto. Dr. Jubert,
Yes, good afternoon po sa lahat, and I thank the sudden invitation from TVUP. Actually, parang blessing in disguise siya kasi nadinig ko nga yung talk ni
thank you,
Nina,
sir.
and
Thank you.
yes, pag TVUP hindi ako nakakatanggi dyan eh. So, thank you for inviting me. And I think basically my reaction, I will reserve public health perspective, of course, for the second reactor. I think my reaction will primarily revolve around me as a clinician and being in the COVID front lines. And as what Nina pointed out, maraming interesting aspect dun sa study niya. But going back to the main topic, yun na ngang the COVID surges in Europe, susunod na po ba tayo? I think that will give us an inkling if you're going to study what's happening in Europe in terms of pwede nga ho bang mangyari sa atin? In order to answer that question, probably yun nga, dapat tignan natin as what Nina pointed out nung sa may intro. Kamusta kaya yung mask and health standards sa Europe, vaccination status, including boosters, and of course, the mobility of the population? Or are we going along that way? Mas nagiging mobile ang population natin, mas malakas ang loob natin magtanggal ng mask. And I was really intrigued by the interviews before the actual talk of Nina, no, the TVUP did. So, these are my random thoughts, and basically I'll try to contextualize it. Number one, kasi I think yung persistent na challenge natin, yung vaccine hesitancy, especially for the booster. So what Nina pointed out, nandun pa rin, laki ng gap between dun sa hindi pa nagpapaboost. And I will go back to what the guard was saying dun sa interview. Parang flu lang yan eh. Parang trangkaso lang naman yan, tsaka ubo. He's right to a certain extent. Right now, what we're seeing is that lalo na po ngayong may mga BA.4, BA.5, I would like to say that in terms of hospital utilization, medyo nawala na po yung kailangan sa ventilator, high flow nasal cannula. Mas marami pong nagko-consult sa amin, mga kaibigan, mga kamag-anak ng doktor, mga anak, mga mobile population telling us, ay nagpa-test ako doc, tapos positive ako, pero wala po akong symptoms eh. Ubo-ubo lang or something. So okay na ho ba yung magpa-isolate ako? So basically, if we're going to contextualize it dun sa perspective ng guard, he may be right. We may be, undermining the effects of COVID. Ang challenge ko kasi dun sa mga nagpapaganon, paano pa pag uuwi kayo tapos let's say meron kayong vulnerable population? Remember, the vaccine is quite effective in terms of, the severe critical forms, death, as what Nina pointed out, ang ganda ng data niya, 100%. But it does not protect us in terms of transmitting the virus once you get it. So yun po yung kinakabahan ako sa ganong line of thinking. Ay hindi, ubo lang, trangkaso lang to mawawala to mild lang pag umuwi ka naman ng bahay, let's face it, baka nga magtanggal ka na ng mask, makihalubilo ka na sa pamilya mo. Paano kung may vulnerable population doon? So that's number one, I think that we should be addressing in terms of siguro booster hesitancy, And I will go back to that later. Number two is, yun na nga, at this point in time of our COVID response, who gets tested? Nabanggit din ng isang ini-interview, pa-test na lang po kasi natin lahat ng galing Europe and everything bago tayo magsara ng borders natin. Kasi sa kanila tumataas. But remember, nagtitest kasi sila. There was a time because my brother is employed in Paris. So madalas pag nagkakamustahan kami weekly, ang pinopoint out niya nga sa akin, bago ka pumunta dito sa grocery, sometimes pag hindi ka completely vaccinated, kailangan ka magpa-test bago ka pumuntang grocery kahit na wala kang symptoms. So dumaan po sa ganong phase yung ibang European countries. And therefore, nasa-shock nga tayo. Ang dami nila per day. Thousands. Samantalang tayo, nung nire-report, nagugulat tayo pag 6,000, let's say, pero nagsimula yan 3-digit. Pero siguro nga, baka nga hindi kasi tayo nagtitest. Principally because going back ulit dun sa sinabi sa interview, sipon-sipon lang yan, ubo-ubo lang. Are we really complying with the minimum health standards, no? So definitely ang masasabi ko hindi, no? So I think it was Yusek Vergere who pointed out in one of her interviews, parang ang pino-point out niya 40 to 60% na lang po tayong compliant in terms of mask, tapos yung nasabi ulit sa interview, hand washing, and then the distancing. Definitely with the mobile population, that's one really of the challenges that we have to contend with. Right now po kasi yung PGH is really seeing yung mga COVID patients po namin around 0 to 2 per day for the past 2 weeks. Pinakamarami na po yung 4. Tapos majority of them, to be honest, halos 50% unvaccinated. Tapos the remaining 50%, 50% which means 25% partially vaccinated. Yung iba walang booster. So fully vaccinated, walang booster. And yes, they do have comorbidities. So yung mga severe to critical namin, remember, meron pa rin ho kaming mga intubated patients na COVID, no? So yung mga severe to critical namin, madalas marami pong comorbidities, diabetes, uncontrolled hypertension, which we already know. Pero ang point ko nga, it's disheartening for me as a clinician when you know face-to-face, tapos parang nagre-replay ulit sa'yo yung nangyari nga as what Nina pointed out during the surges. Yes, hospital utilization is quite down, so mukhang kakayanin po. But remember, if we're not responding well din kasi, automatically, kapag hindi po kami nagbababa masyado ng COVID allotted beds namin, nababump off automatic yung mga non-COVID patients as of this point in time. Which I think is quite disheartening kasi PGH ka, ang dami pong mga pasyente galing kung saan-saan, yet you cannot admit them. No? You cannot admit them. So, dahil po COVID designated beds, no? Tapos nahihirapan po sometimes yung hospital, to gagawin mo siyang non-COVID, magsisearch ang COVID, babalik mo siya sa COVID. Remember, this should have manpower complements, this should have engineering complements, machine complements. So nandun po yung napapakita kasi ni Nina yung overall, no? But if you are face-to-face with a patient and then face-to-face with their relatives, sometimes hindi mo po makuhang mag-sermon to a certain extent. Kasi ang point mo, andyan naman yung vaccine eh. It's available, it's accessible, and as what Nina pointed out, maski ng booster nandyan. Bakit po kasi kayo hindi nagpa-vaccine or nagpa-booster si nanay? Ba't hindi tayo nagpa-ganon? Dami na po nilang sinasabi. And then going back dun sa interview, parang halos ganun po yung sasabihin nila. Si nanay po ay nasa bahay lang eh. Kami naman po fully vaccinated. Tsaka kami po yung gumagala-gala dahil nagtatrabaho. As what I've pointed out, vaccines cannot protect against you carrying the virus and possibly infecting others as well. No? So pwede kang maging carrier. No? Tapos yung latest talaga namang medyo hindi naman controversial, pero multi-perspective issue is who gets the booster at this point in time. Remember, marami po parating issue kasi sasabihin accessible, grabe, marami na ngang expiring na booster, bakit hindi na lang po ibigay? And then we'll get some kind of answer. If we're going to look at science, as of this point in time, science is telling us that the second booster, greatest benefits will be for immunocompromised, elderly, and then the frontline health workers. And therefore, our policies were crafted along that line. But maybe at this point in time, baka magalit sa akin si Ma'am Susie kasi public health perspective, and we all go by statistically significant thing, what are the studies telling us. But ang point ko, kung clinical significance naman para sa akin. For example, yung anak ko, mobile population. Pagsasabihin sa akin na pwede siyang magpa-second booster, kung may access ako para sa anak ko for a second booster, hindi siya nag-fulfill dun sa HTAC criteria, papa-second booster ko po siya. Unless now, of course, because the studies are telling me, gaganda po yung immune response niya, tataas yung antibody. Yes, it might not necessarily translate to clinically significant outcome, but for me personally, that's a clinical significance already. Kasi syempre kahit na sabihin mong alam mo, hindi ganun naman, dapat prioritize natin tong population na to. Ayaw po nila eh. Di dapat kung sino po yung may gusto. Tapos magko-consent naman, no? Because I would like to see as what Nina pointed out, tumataas yung antibody response. Lumalaylay na ngayon yung antibody natin, waning immunity. Bakit po natin hindi gustong ibigay dun sa mga gusto namang magpa-second booster? I fully understand the argument of HTAC. Let's look at science first. It should yung expiring vaccine should not dictate whatever policies we craft. I fully understand that and I appreciate that. I acknowledge that. But when sabi ko nga ibang perspective po kasi ako eh. When you see a patient na COVID tapos you begin to interview or the family members, ang maiisip mo talaga sana nagpa-booster ka na lang. Ikaw din nagpa-booster ka na lang. At that stage on the ball game, wala naman pong sisihan yan, di ba? Pero yun nga yung sigurong pwede pa ho nating magkaroon ng elbow room for discussion and the possibility of offering it to a wider range of population. Why? Because at this point in time, hindi po talaga natin alam yung impact po ng COVID in a population such as ours na fully vaccinated. At least binigay ni Nina yung snippet if we're going to say that what's happening in PGH is a mirror of the society. And as what she mentioned, primarily vaccinated, primary vaccination, okay na yan. Pag ma-booster, tataas pa ho. Then we come across some things kasi, no? So sasabihin minsan ng patients namin, no, yung mga relatives, Doc, nagka-COVID na ako eh. Tapos nagpa-primary vaccine pa ako. Hindi po ba tumaas ng tumaas dapat yung antibody ko? Ba't ko susugal pa na magpapa-booster ako, no? So we come across such concerns and maybe yun po yung mga studies siguro na kailangan po natin at this point in time, tailor fit the study, especially real world effectiveness study in terms of crafting the message kasi kailangan po natin at this stage in the ball game na parang game changer. Sabi ko nga kay Nina minsan, alam mo, kulang na lang na magbigay tayo ng phase for that, yung phase na nagkaroon ng COVID, tapos let's say na booster siya compared dun sa hindi nag-primary vaccine tapos hindi naman nagpa-booster. Because I think yun yung sigurong mas compelling sa mga tao, yung magkaroon ng storya behind it. Nina touched a little bit during the discussion nung intro about long COVID. It's a real thing. It's a real phenomenon. And the best way to, of course, prevent long COVID is for someone not to get COVID in the first place. So, pag nabakunahan ka, nagbibilong ka dun sa population that's being targeted right now, magpa-booster ka. And I think that's a rational way in terms of approaching that in order to prevent that catastrophic outcome of long COVID. Pero ang pino-point out ko nga, we still have a lot of things to do in terms of trying to craft an ideal message in terms of having more people being boosted at this stage in the ball game na sinasabi nga nila ay ubo-ubo lang yan, trangka-trangkaso lang yan. Pero kasi natatakot sila, to be honest, kasi pag binooster sila, hindi ko po, Doc, alam ang reaction ko dyan eh, no? Kung binooster po ako, hindi ko po alam kung okay na ako, bumabalik na ako sa trabaho and everything. So I think that's the dynamic right now in the ball game in terms of trying to grapple with this COVID na parang never ending. Sabi ko nga parati, I think the enigma of COVID remains unresolved completely. Hindi pa ho natin siya mabasa completely. Yes, there are positive signals on how to interpret the data, on possibly, as what Nina pointed out, how to, craft or tailor fit your intervention based on what the data is telling us. Yes, I fully agree with that. But at this stage in the ball game, yun na nga sabi ko, there are crevices there that might offer certain interventions, not necessarily 100% based on science, but I think it will make perfect sense on an individual basis and if you're considering individual health. Thank you po ulit.
Okay, thank you very much. Ang galing-galing naman ni Hubert. Grabe. Ayan na naman, makikita mo na naman yung mga hearts at mga palakpakan. Actually, Hubert, thank you for taking, for being here. And I'm glad you accepted it kasi your perspective is really very different, no? Kasi nakikita mo yung mga serious cases of COVID, no? And we tinumbok mo yung problema nung communication, no?
Yes,
Kasi,
ma'am.
'di ba? Kasi sabihin natin, priority yung immunocompromised tsaka
Yes.
yung elderly. Is that enough to say that they
Correct.
are the priority? What are you actually doing? What's the action to get them all vaccinated so we can move to the others?
Correct.
And hindi pwedeng sabihin lang na priority lang 'yun, ano? So I can see where you're coming from, and I also have some controversial views on this, but anyway, we're gonna take this up in our next episode. But speaking of communication, okay, thank you so much, Jubert. Kita mo na pa yung mga hearts tuloy-tuloy na. Speaking of communication, we have from the Department of Health the concurrent Director 3 of the DOH Communication Office and the Disease Prevention and Control Bureau, another favorite of yours, Dr. Albert Domingo. Albert, welcome and thank you for accepting also on short notice. Albert.
Thank you so much, Doc Susie, Ma'am Susie, and Doc Raymond. Hello, classmate, at hello uli sa lahat ng ating mga taga-panood at taga-pakinig. Special hello also to my professors, Dr. Nina BERBA and Dr. Zubert Benedicto. It's really difficult to give a reaction, especially to a former professor. And nagkataon lang po talaga, hindi ko sinadya na puro logo yung t-shirt ko. Nasa opisina po ako ngayon, naka-uniform. But what I'm about to say is really a reaction. I am part of the Department of Health, but we always are very careful with what we say, as correctly identified by Dr. Benedicto and by Ma'am Susie, Dr. Susie. Ang hirap po talaga, no, ipahiwatig kasi parang on the one hand, ayaw nating magpanik, ayaw nating matakot ng ating mga kababayan. On the other, ayaw rin naman nating magpaka-relax na lang na okay na tayo. Maganda yung sinabi ni Doc Zubert na parang pag sinabi mo kasi na para siyang trangkaso na lang tsaka parang simpleng sipon, baka isipin na lang ng ating mga kabayan, sipon lang pala di papasok pa rin ako sa trabaho. Pero actually, yung sipon na yon sa kanya, na vaccinated siya at boosted siya, baka maaari siyang malipat, no? Maaari siyang mapunta sa isang tao na hindi ganoon kaprotektado. And having said that, I will just share, sabi ko sa chat namin kanina ng mga moderators 2 slides, medyo dumagdag lang po ng konti, naging 4. Go ahead. Right. So, picking up from what Dr. BERBA said, no, yung kanyang presentation ni Doc Nina na talagang nakita natin lalo na natuwa ako dun sa numbers na pinakita na yes, there is an additional layer of protection coming from the booster. To connect it to the question na episode natin, mangyayari ba sa atin yung nangyayari ngayon mula sa ibang bansa? Let's look at the data. What you're looking on, what you see on the screen rather, was reported out, was presented by Undersecretary Vergeire last June 28. Ito po yung lumabas sa media. And the banner, as you see, we are not hiding anything sa Department of Health. Sinasabi naman namin ang data as it is. COVID-19 cases continue to rise across all regions. But I'd like you to pay attention. So bago po tayo magtaka na parang ang taas ng pinanggalingan, tsaka pasensya po, medyo maliit kasi yung mga numbers. But let me read to you the scale. The axis here, the y-axis, actually has a maximum number of 350. no? 350 per day. Tapos yung pong mga petsa sa baba para ma-orient tayo dun sa ating tinitignan na timeline mula February 22 or 23, sorry ako mismo naliliitan dun sa tumitingin po ako sa screen ko, hanggang this is para bang July 3 yung dulo, pero actually yung data hanggang July 23 and so on. Alright, having said that, yung pinanggalingan natin na mataas na punto dun sa kaliwa, that was actually the end, no? Towards the end of the Omicron wave that we saw at the start of the year 2022. Tapos if notice, no, parang naging flat siya, nagstay down siya to below 100 cases per day for NCR, yung blue line. Nakatingin po ako sa blue line ngayon. Tapos tumaas siya, nagkaroon tayo ng steep increase in reported cases simula June 13, kung di ako nagkakamali sa nakikita ko numero sa x-axis, June 13, at tumataas siya. Does that mean na nagsisimula na tayo sa isang panibagong situation na dumadami ang cases? One thing that is interesting and that we have to take note of is kahit tumataas yung bilang ng mga kaso, balik natin, no? Tumataas yung bilang ng mga kaso, the reassuring data, I say reassuring to actually balance that we still need to be alert, but at least we should not panic. We look at the number of severe and critical cases. This remains less than 1,000 nationwide despite the continuous case increase. Should we be happy? I don't think we should be happy in the sense na magre-relax na tayo, but we should be reassured that thus far, what we are doing is actually helping us control the numbers. And what have we been doing thus far? Yung sinasabi na PDITR, no? Prevent, Detect, Isolate, Treat, Reintegrate. No? Yan yung ibig sabihin ng PDITR. Yung pong nakikita natin, karamihan ng data na pinakita nila Dr. BERBA and most of the reactions nakikita na nabanggit din Dr. Benedicto are from the hospital. They are from the treat side. But of course, this is all interconnected. Ang Philippine General Hospital bilang isa sa ating mga very close and reliable partners pagdating sa COVID-19 response, para siyang pag nag-alarm ang PGH kasi marami siyang cases, kahit ba hindi mo tignan yung numbers dun sa bahaging detect yung mga testing, parang na yun parang may warning sign na yun, may signal na yun. And thus far as probably we have seen from the data of Dr. BERBA, and you will also be able to check mula sa ating mga kakilala, ating mga colleagues sa Philippine General Hospital and also in the other hospitals, hindi po tumataas yung numbers. Because the prevent, the detect, and the isolate parts are working thus far. The detect part, when I say that the detect part is working, yung BA4 and BA5 as early as May, if I'm not mistaken, the first or the second week of May, we did report na nakapick up tayo ng BA4. There was a BA4 that was picked up on the early part of May. And that was following the protocol na kapag meron tayong kababayan na dumating mula sa ibang bansa at siya ay hindi vaccinated, siya ay may required na isolation of 5 days, mandatory isolation in the facility. Tapos meron siyang test on the 5th day. Tapos kung negative siya, continue para bang close monitoring at home. Pero kung mag-positive ka, you have to complete the minimum number. If I'm not mistaken, the latest protocol is 7 days or 10 days inside a facility. So the whole chain of PDITR is working thus far. But this is the point where I say but. But it will only work if we keep on doing our part. There is one more letter that is missing from this collection of letters, PDITR, and that is the letter V, the vaccinate. Yung vaccination natin, bakit ba tayo nagba-vaccinate? Bakit ba ang kulit-kulit ng DOH? Ang kulit-kulit nila Dr. BERBA, nila Dr. Benedicto, lahat na nagsasalita magpabakuna at lately, pati magpa-booster, kinukulit na natin ating mga kababayan. Kasi kung gagawa tayo ng drawing, ito yung drawing na yun. Literal na may drawing tayo. Of course, this is symbolic or hindi naman symbolic. This is a representation of the concept of having a wall of immunity. Yung mga parang bola-bola na may tusok-tusok, yun yung nagsisignify dun sa ating virus. No? Pag yun yung virus natin, tayong mga kulay green sa drawing na to, the fully vaccinated and boosted, we serve as the wall to protect those who are in the middle. Yung sinasabi ni Dr. Benedicto kanina na yung mga vulnerable yan, sila lolo't lola, yung mga below 5, wala pa tayong authorized na bakuna sa mas bata sa 5 years old. At yung mga for whatever reason there is, hindi sila mabakunahan, hindi ko acceptable yung I don't want to be vaccinated sa totoo lang. Kasi ang sinasabi ko po is yung medical reasons. When I say hindi acceptable po, no, I'm talking from the immunologic perspective. This is not a debate on opinion or on legal perspective. This is the science behind it. If we want to keep the wall of immunity strong, if we want to keep this shield, this yung nakikita nating para bang protection na yan para hindi tayo pasukin ng virus, we really have to ramp up our vaccination. And I do realize, I hear the para bang the feedback na parang I want my my loved one, I want my particular person parang vaccinated already, my child, my grandparent, etc. Particularly with the second booster. And that's our para bang segue to next episode. Nag-plug na rin for the next episode kasi I heard na magpapasok ang TVUP ng special guests or resource persons next week na pag-uusapan yung science behind the second booster. But this early, I do agree that the burden really is in the actions. Ano bang kailangan nating gawin para dumami yung vaccinated with the primary series, yung first 2 shots na sinasabi, and also the third shot, yung first booster? Kasi the reality rin po is, even if we are able to get someone vaccinated and boosted up to the second booster, the chances of that person getting the virus will still be high kung yung mga nakapaligid sa kanya ay hindi vaccinated. As we heard from our 2 eminent clinicians, no, sila Dr. BERBA and kay Dr. Benedicto, the vaccine doesn't stop transmission. That's the fact of life. But it prevents severe and critical cases from taking place. That being the premise, kung ating hindi iunahin, no, hindi natin paiigtingin. Siguro I should avoid using the term prioritize. Let's look at the term focus. Kung di tayo magfo-focus dun sa mga para bang kailangan paramihin na wall of immunity, yung mga nakaganyan, yung mga nakalabas yung kamay, yung mga sabi nila stop COVID-19, di ba? Dapat sila talaga yung unahin at paramihin ng primary series tsaka nung first booster para kahit ba ikaw ay may second booster hindi naman nakakatigil ang transmission, the chances of you getting it, I will not go into the details, but I also have been reading that, yes, it does not totally prevent transmission, but the amount of virus that is shed, mas expertise nila Dr. BERBA to yung mga infectious disease specialists, the amount of virus that will be shed by someone who is fully vaccinated and boosted is much less than someone who is not vaccinated at all. Suma total, kung medyo nakalilito na po yung karamihan na sinabi ko, tingnan lang po natin yung drawing na nasa screen natin. Bawat isa sa atin na bakunado at boosted, first boosted, kasama tayo dun sa green na mga tao na pumipigil, humaharang, nagsasalba dun sa mga naka-orange. Pinipigilan natin yung COVID-19, sinasalba natin yung ating mga mahal sa buhay at pinaprotektahan natin sila mula sa isang alam nating malalang sakit kung sila ay tamaan. So, at the end of the day, what's gonna happen when is this pandemic going to end? Isa pa yun sa mga favorite discussion points eh. This pandemic will only end kapag lahat tayo sa buong mundo, in theory, ay talagang kaya ng fully vaccinated and boosted. Pero syempre, hirap ba naman na, 7 billion, 8 billion people, mahirap gawin yun. So nagkakaroon lang talaga ng para bang operational challenges na sino yung tututukan, sino yung para bang sasagarin yung vaccine coverage para agad-agad na mataas kagad yung nakikita natin na wall of immunity sa drawing na ito. So maraming salamat po and back to you, Dr. Susie and Dr. Raymond.
Yeah, thank you so much, Albert. Again,
Dr. Albert.
another
Communication.
okay ba classmate mo? Okay? Okay na yung classmate ko, di ba?
Oo nga, sabi ko nga, classmate mo si Dr. BERBA, tapos classmate ko si Albert. Kaya,
No, very good, Albert. I mean, I put on my communication hat for 2 seconds here. I like that picture of the wall. And actually, I think what we need to focus on is really how can we make each family accountable for the boosters and the vaccination. Kasi kung meron man puwersa sa atin, mga Pilipino, pamilya yun eh. Hindi ba? Parang how do you convince the immunocompromised, your older persons, mga seniors? The family has to do it eh. And actually, what we should aim for is 100% vaccinated families. No? Of course, in phases itong booster, pero kailangan may approach tayong pang Pinoy eh, pang Pilipino. Hindi pwede yung sabihin lang natin, priority ito, priority no. each family has to be accountable for their seniors and so on getting boosted. Anyway, not to preempt our talk next week, but let's call everyone in now for our panel discussion. We do have time to have a discussion. So let's have Nina and Jubert and Albert, plus, of course, Raymond. Okay. And I think, but before we do that, Raymond, we do have a public service announcement. Let's have that, TVUP.
Okay.
Maaari na bang magpabakuna ang mga batang 5 hanggang 11 taong gulang?
Oo, nagsimula ito noong Pebrero.
Nagpapakuna na ba kayo?
Oo, nagpapakuna na kami.
Kaya mga bata, magpapakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you, TVUP. The COVID Communication Public Service Announcement is one of the many creative outputs of the Stop COVID Deaths team to push for pediatric vaccination for children aged 5 to 18 years old.
Okay, so I've seen some interesting questions in the Q&A box, Raymond. But before we do that, I was gonna ask our group, no, I mean Nina and Jubert and Albert, no, kasi I think Nina's data is really very, very important, particularly for our frontliners, no. Do you think, okay, to what extent do you think our frontliners, including our audience right now, right, are aware of the importance of the boosters? Sige, we'll start with Nina.
I think for most part, many healthcare workers are interested and actually convinced that boosters are important. Yeah. Meron lang talagang baka yun, just as Jubert was describing, started to feel na a little bit maybe complacent kasi hindi na masyadong difficult, severe, critical yung nakikita nating mga patients.
Yeah. Jubert, anong tingin mo? Health workers natin, frontliners, naiintindihan ba nila?
Yeah, I think so, Dr. Susie. Talagang naintindihan nila, and to be honest, PGH for example, wala pa yung booster, nababalitaan pa lang, nagka-clamor. Kailan ba mag-booster ang PGH? Kailangan ba namin mag-electronic registration ulit para lang magpa-booster? So there was really a clamor for it. So in terms po sa booster, healthcare worker or frontliners, yes, I think well inculcated po yung message.
Okay, kasi importante yun to convince the patients, di ba? Na
Yes.
yung healthcare workers mismo, maganda ang pag-explain nila. Raymond, Albert, what are your thoughts on this?
Yeah, I was trying to look quickly, Ma'am Susie, for the data. The exact numbers escape me now, but I don't think we still have a high number of first booster. Surprisingly, first booster for healthcare workers nationwide.
Okay.
The exact number, mabagal yung internet, pero the exact number escapes me right now. But hindi pa po siya ganun kataas eh. And that is really challenging. As you mentioned po, na kung mismo nga ating mga healthcare worker ay hindi nagpapa-first booster, paano pa natin ipupush, no, na parang kailangan lahat tayo magpa-booster at the general. So this is actually what is facing us now. And para bang the challenge really is it really a lack of a sense of urgency? Kasi the very same message that we say na konti lang naman yung nagiging critical and severe, pag sinabi mo yun, maski sa isang healthcare worker, parang baka iba yung maging dating eh. Unless that healthcare worker has already para bang participated in the direct patient care of a COVID patient. Kasi kung ang healthcare worker ay hindi naman nakakita ng kaso, wala siyang parang, me being a healthcare worker myself na nag-public health na, pag hindi ko nakikita yung human element na talagang nakamamatay siya at delikado siya, medyo yung sense of urgency nawawala eh. I have a sense of urgency because I see the data as DOH. Pero kung ako po ay nasa field sa isang malayong isla, for example, na sa awa ng Diyos ay hindi kami nakapasukan ng COVID at wala kami nakikita na ICU, yung complacency pumapasok. So yun yung challenge. Wala sa akin po yung sagot ngayon, pero yun yung mga tinitignan natin na mga kailangan ayusin.
Yeah, so I think that point about our frontliners and in this group, our community in Stop COVID Deaths are actually frontliners, no? Parang napakalaki nung impact nung ninyo ng ating mga viewers on this webinar in terms of convincing, and I go back to families, how important it is for the high priority groups to get vaccinated, to get boosted, and later on for everyone to get boosted. No, but just going back to that a little bit, Albert. The idea of boosting or getting a shot because there is an urgent thing like a pandemic. I think when we look at routine immunization of children, right, like EPI, whether that's BCG, measles, etc. No, what should I say? The approach, the public health approach, really is to say that this is routine. You need it. You know, you have a card. You need to get this on this date, whether or not people are getting sick. And I think that's what's going to happen with COVID. We're going to have, like the flu vaccine, a vaccination regularly, whether or not maraming kaso. Kasi that's the only way you create the herd immunity in the end, no? There's really got to be a regular routine boosting of the immunity of the entire population. So in terms of communicating it, we have to think about it as routine ito. Parang every time birthday mo or whatever it is, kailangan kang mabakunahan, no? So yung idea, we have to now what should I say, to disconnect or to uncouple the idea that you need the vaccine so that you won't get sick. You need the vaccine, period. Parang we all need the vaccine. Parang ganun dapat ang approach natin. Anyway, so that's just me commenting. Sorry, absent kasi ako last week. So medyo abusado ako ng konti. Raymond, Raymond, go ahead.
If I may, si Albert po. If I may quickly add lang kasi bumukas na yung website. So ayon sa ating vaccination dashboard nationwide, this is publicly available. Sa 3 million na A1 healthcare workers, 3 million, 1.4 million pa lang ang nakakuha ng first booster. So yun. Compared, now if you look at the numbers, interestingly, yung mga priority groups from A1 to A5, ang pinakamarami, hindi ko napapasukin yung proportion, absolute number, ang pinakamaraming priority group na na-booster ng first booster, 5 million mula sa A4, frontliners in essential services, economic frontliners. So, of course, mas marami sila compared sa healthcare workers, pero kumbaga sa unahan, sa parang now I'm this is actually an insight that's forming in my head right now. Parang what was the incentive? Bakit sila game na game magpa first booster? Pero tayong mga nakaputi, mga healthcare worker, kalahati pa lang sa atin. So yun yung mga questions na kailangan. And it ties nicely to what you said, ma'am, na kailangan matanggal na natin sa isip natin na pang-rescue lang siya at kailangan talaga routine na siya. Over.
If we're really saying this is endemic, correct? Then it should be routine. And the way this should be managed should be like a program. Like every year you have to vaccinate X million people. That's how it's going to be. So, sorry, nag-ubuso na ako. Sige, Raymond. May ibang question dyan. Sige.
No problem.
Okay, go ahead,
because this was in the news, Dr. Susie, a couple of days ago, I believe. And this is a result po, no, that the National Vaccine Operations Center is shifting its tasks and responsibilities to the Public Health Services team of the Department of Health. In one of the interviews, DOH was quoted as pushing for the redefining what fully vaccinated means. So I'll post this to our DOH colleague. Is that something, how does the DOH propose to make that as per policy, and I'll connect that to the question here because I think there's a concern with regards to hindi pa raw po babaguhin ang definition ng fully vaccinated to include first booster as a requirement. Okay, Albert?
Thanks, Doc Raymondo. Yung decision to make it part of the definition definitely does not belong to the DOH. It belongs to the IATF, the Interagency Task Force. Now, from the scientific perspective, the DOH has been presenting the data na yung term na ginagamit, again, may communication element yan eh. Sa US, ang ginagamit na term up to date. So, ang difficulty kasi, that's why it's the IATF who discusses these things and not just the DOH alone. There are implications on mobility. We do remember nung 2021, nung bagong ang vaccination, na parang there was a time when the former president, Rodrigo Duterte, said that kung kayo ay hindi bakunado, hindi kayo makakabalik sa trabaho. Biglang dinagsa yung mga vaccination centers nagpuntahan. So there are real operational implications to how you define what fully vaccinated is. And it's a very sensitive issue for the very reason that it involves mobility. So we do not have the authority to decide on it, but we always submit the latest data, including what we mean by being up to date and the data on the waning immunity and all of that information to the appropriate authorities.
Yeah, I mean, I think Nina presented really some very important slides on waning immunity. And that needs to be taken into consideration, di ba? Kasi habang nagtatagal, di ba? Bumababa yung immunity ng even the frontliners. Then we create a dent in your bubble, di ba? Your that shield that you're showing. So I think the thing is, we have to be nimble. We have to be flexible. Na I think that's what you're trying to say, Albert, no? Na nagbabago. And so the question about what is fully vaccinated and period, yun na yung fully vaccinated. Nagbabago pa po eh. No? Nagbabago-bago yung kaalaman natin. Siya nag-mutate din yung virus, no? So anyway, okay. So I don't know if Nina wanted to comment on that or Drew.
There's also another question before Dr. Nina comments. Ma'am Nina, when you presented the Philippine Vaccine Effectiveness Study interim results, I think they noticed po, no? And this is one of the questions here. They want to ask, has there been any trial or any study that has looked into mix and match naman po for the boosters but not for the primary, ma'am? So go ahead, Dr. Nina.
Nick, may mix and match siya. Merong ganong klaseng study trying to see combinations. Pero actually, I responded nga to that question of Ma'am Cherry. Siguro may extract namin yun eh. Di ba parang we have data of the different kinds of combinations. Sobrang daming combinations. Nagulat din ako na ganun kadami yung permutations na produce ng iba-ibang vaccine. Pero kasi there is parang wisdom din eh in promoting heterologous, yun yung term, di ba, for a different vaccine, different from your primary series. Parang it sort of blends or synergizes your immune response. Instead of staying, for example, with Sinovac. Surely may ganong combination dun sa aming database and we can extract it. Pero data now seems to, better, seems that the outcomes are better pag heterologous.
Follow-up question, Ma'am Nina. Any inputs as to why only Pfizer and Moderna are being parang push po with regards to the booster brands? Kasi I think there's a preference na AstraZeneca siya. Sana AstraZeneca daw siya all the way. Something to that effect. So what are your thoughts on that, ma'am?
Hindi ko alam. Hindi ko alam yung sagot. Pero in my mind, it's really because yung mRNA vaccines have been seen to really do a good job sa boosters. ano to mga parang small trials, tinitingnan mo how things go in the population, and so far that's the data that's apparent. Yeah. So, yung Sinovac, parang hindi pa natin nakita kung ano yung effect nun. Pero you're correct. Para baka dapat tignan din yung ganong klaseng combination.
Yeah. Okay. Well, I think we can continue talking about this, but we're running out of time. Maybe Raymond, one last question.
So one last question here, and this is just because I've seen a whole lot of colleagues and relatives po, no, who have had COVID, and I'll tie this up to one of the other questions outside of the Zoom. The question here from Zenny Sardido is, are the effects of post-COVID symptoms for life, and which COVID vaccine gives you parang the best chance of not having those long COVID effects daw po?
Si Jubert na lang sasagot dyan.
Dr. Benedicto, sir.
Jubert, ikaw daw.
Okay,
Jubert,
so thank you for the question, Raymond. So post-COVID condition. So studies have consistently shown that ang parang consistent thread lang po or message sa mga studies ng long haul COVID or post-COVID condition is that mas more severe, mas more likely or more at risk ka magkaroon ng long COVID or post-COVID condition. The more comorbidities that you have, most likely magkakaroon ka ng post-COVID condition. Now, kung gaano po siya katagal, studies have shown that after, let's say, 3 to 6 months, yun pong cough and difficulty of breathing, yung pong nagte-tend to persist. So yung iba mawawala na po siya, but it tends to persist in terms of yung cough, tsaka po yung dyspnea or difficulty of breathing on exertion. But then again, if you're going to follow up all these patients, after 1 year, significantly bumababa na naman ulit siya. So we are quite confident that, with proper intervention, especially rehab, tsaka multidisciplinary approach, kayang-kaya po siyang ma-address. Ang parati ko lang sinasabi ko sa mga patients, wag po kayong bibitaw kasi sama-sama po tayo dito. Kasi minsan na-frustrate sila. Maski mental fog. Mental fog is a post-COVID condition. So yun po ang ginagawang reasoning ata sa akin ng ibang mga estudyante namin na residents and fellows na nagkaroon ng COVID pag hindi nakaka-answer sa question during rounds. Sir, post-COVID condition po.
Sir Jubert, how about the second question, sir? Any studies or anything?
Okay, sorry. About vaccine. I think I will go back to what Nina presented. Wala pa siya kasing consistent studies but as what she has shown, parang Moderna yung nagme-maintain nung antibody, but it was not correlated to the prevention of a post-COVID condition. So the messages across all studies is that pag na-prevent mo yung COVID, definitely hindi ka dapat magkakaroon ng post-COVID condition, especially if you are going to prevent the severe forms.
Okay. Thank you.
Nice.
Raymond and Susie, pwede ko ba sabihin?
Na. Sige.
Yung dun kasi baka ma-misinterpret kasi yung some of my slides wherein yung orange bars that represent nagka-COVID ka na kaya ang taas ng antibody level.
Yes,
So baka kasi ma-picture niya na, di magka-COVID na lang ako, mataas pa yung antibody level ko. But the threat and the fear and the potential of having long COVID, talagang you wouldn't want to have COVID at all. Kasi kami nga ni Jubert, we do see long COVID, patients with long COVID. Parang yung mga anak mo, ayaw mo talaga sila magkaroon ng ganun. So, nangyari lang na the antibody levels are higher because you got COVID, but it does not mean it's something to aim for. That's not the interpretation of the graph that I showed.
Yeah, thank you, Nina. And I think at another point, because you just came from a conference on long COVID, we should talk about this. But I'll just take advantage of this moment to say that, the more I think about it, we keep on talking about individual risk. I think we should provide families with tools to assess their own risk. Diba? Kunyari, may health worker ba sa bahay? Diba? Meron bang mataas ang comorbidity? Meron bang teenager na labas ng labas? There should be a way for a household to say na, teka nga, parang hindi tayo safe dito eh. No, parang we have to give that information back to people, and that can be the stimulus for getting people boosted. Kasi if we're always talking about individual risk, then people won't care about other people because it's just me, right? It's just me. But I think what Joubert has been saying is, no, you've got a responsibility to other people in your family, in your household. So in the same way na merong parang yellow card yung mga bata sa bakuna, dapat yata meron tayong family card or household card para alam natin na, ay teka muna, di ba? Parang delikado yata ito. Maraming umaalis, lumalabas, gumigimik, nagka-clubbing yung mga bata, and yet may lolo sa bahay, di ba? So we really have to empower people to understand their family and household risk as we move forward. Anyway, I'd like to thank our guests. Palakpakan natin silang, galing nila, you know?
Thank you.
Thank you. Makikita nyo naman yung mga hearts, yung mga ano. And, actually, Joubert and Albert came on board just this morning because we were supposed to have Ted and Martin, but unfortunately they couldn't join us, but we'll get them at some other time. And we will call on you again, Joubert and Nina and Albert, to talk about long COVID. Okay, so we're going to give you, we're going to give you a moment to formulate your parting words for our audience. And meanwhile, Raymond has the fun quiz and our evaluation. Go ahead, Raymond.
Can we have thank you so much. So the two questions that we have, the BA.4 and BA.5 subvariants belong to which COVID-19 variant? 90% in the Zoom chose Omicron, while 93% chose Omicron in the Slido po. No? So just based on our discussion, we all know it's Omicron as the correct answer po. And then for question number 2, are the BA.4 and .5 subvariants causing the COVID-19 surge in Europe? So, like I mentioned, it was a giveaway. 93% chose yes for Slido, 98% chose yes for Zoom. So, maraming salamat po sa lahat-lahat ng sumali for our fun quiz. But before we forget, we'll also give some more time to our panel of experts as we try to answer this 5-question evaluation poll po. No? We do not send out a separate evaluation poll. This is the only one that we have. So we encourage everyone to please input your feedback po. No? This is a 4-point Likert scale for each question. As follows, the panelists demonstrated thorough knowledge of the topic. The panelists were well prepared and organized. The panelists spoke clearly and audibly. The panelists used appropriate language, technical medical jargons adequately explained. And then finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. We will not be closing this panel discussion poll as we move on to the parting words from our panel of experts. Dr. Susie?
Okay, thank you very much. We'll start with Albert. Albert, your parting message.
Thank you, ma'am. Thank you so much again to TVUP for inviting me to join you as a reactor this afternoon. Alam niyo po mga kababayan, ang 2022 is not 2022. Ibig sabihin sa Tagalog, hindi natin inuulit ang taong 2020 sa panahon ngayon. Nung nagsimula tayo noong 2020, hindi natin kilala pa sino yung kalaban natin. Nung nalaman natin kung sino yung kalaban natin, hindi natin alam kung ano yung mga sandata, hindi natin alam kung ano yung mga treatments. Alam nila Dr. Joubert yan, no? Dinaanan, at saka nila Dr. Nina, no? Ang daming mga dinaanan. Yung proning, yung iba ginagawa na ngayon, naging standard of care na. Yung high flow nasal cannula, there was a time na tinatanong pa ng mga tao, HFNC, may use po yan o hindi? And then dumaan si hydroxychloroquine, si ivermectin, di ba? May mga nagpanggap na solusyon pero nakita natin wala rin namang bisa. And then dumating yung mga steroids, dumating yung mga antivirals. At ngayon may mga mga tableta na pwedeng inumin under compassionate special use permit, yung mga outpatient na nakakababa ng risk. What I'm saying is may mga lunas na po sa COVID-19. Hindi pa siya totally matapos pero meron tayong mga panimulang sandata. Meron din tayong mga bakuna at mga booster na safe at effective na ating ginagamit para tayo ay hindi maging severe at critical. And alam na natin, paulit-ulit na rin sinasabi ng DOH, nila-debate siya, COVID is airborne. Which means you wear the best fitted mask, the best possible mask that you can have, and you try to choose, no, you don't try to, you choose, piliin ang best, the best ventilation, ensure good airflow that you can have. So, ibang-iba na talaga yung sitwasyon sa ngayon compared dun sa dati. Does that mean magre-relax na tayo? Hindi pa po. So, lahat po tayo dapat fully vaccinated, up to date with our first booster. At kung may mga kilala tayo, lalo na sa loob ng bahay natin na medyo hindi pa kumbinsido, atin na po silang kumbinsihin. At once eligible na tayo for the second booster, let's go ahead with that. Over to you, Ma'am Susie.
Thank you very much, Albert. Okay, let's go to Jubert Benedicto. Jubert, go ahead.
Yes, so thank you again, TVUP, for the invitation. Siguro short lang yung message ko out of all these things na nasa inyong kakayanan ng inyong pamilya ay maprotektahan. Magpapakuna, magpa-booster.
Ay, thank you so much, Jubert. Okay, Nina.
Ako, I'd like to thank UP-TV for this invitation. This is actually the first public showing we have of this interim results. So while we're working on the other sites, let me assure you na we will continue to cascade this new information that we have. Pero with the 400 plus participants who are here, I'm sure matutulungan nyo rin kami if you can cascade it to your families and to your workplaces and to the healthcare worker force that you have in your own facilities. So thank you very much again.
Thank you very much, Nina. Thank you, Jubert, and thank you, Albert. No? So we are now, okay. So, Raymond, did you want to go through the evaluation? Or tapos na tayo? As
Okay.
maski partner sa kanila.
We are seeing po no that at least video. At least thank you. At least 96% of all of those who participated in the evaluation poll indicated that they strongly agree with each of the questions. We still have a few more who are trying to answer the evaluation poll po, no? So, we'll keep it open as Dr. Susie calls on our synthesis and closing remarks speaker.
Okay, so as always, we have three in-house parang closing remarks resource persons na talagang ewan ko kung paano nilang nagagawang i-condense into a few minutes yung almost 2 hours, but today we've got Dr. Stella Marie Legaspi Jose, who is the Assistant Director for Philippine General Hospital. Stel, take it away.
Good afternoon, everyone. Thank you for those excellent lectures from Dr. Nina BERBA, Dr. Jubert Benedicto, and of course, the student of the two of them, Dr. Albert Domingo. It was really exciting to listen to all these new developments. And I agree with Susie that I will have a hard time digesting that lecture of Nina. So I invite you to watch the recording of this webinar. The summary of her talk for vaccine effectiveness. So let me just point out the difference between vaccine efficacy and vaccine effectiveness. Sometimes people interchange them, but they're different. When you say efficacy, it's in the clinical trial setup where the conditions are controlled. In vaccine effectiveness, this is the real life scenario already. So the summary of the vaccine effectiveness for PGH healthcare workers, so the effectiveness against death for all vaccines is 100%. For hospitalization, she said it's 74% in her study. For severe or critical COVID, it is 83%, and in the symptomatic COVID, it is 40%. So what we are saying here is that she wants to show us the importance of having the complete vaccine dose, the 2 doses of vaccines. Then she said that it is the adequate vaccine effectiveness for healthcare workers. It should be protective against hospitalization, severe forms of COVID, and death. Okay, so I encourage all of you to still, for those who are not yet vaccinated at this time, to get your vaccine. And boosters give additional protection. I think this was mentioned in many of our webinars. I think like 4 or 5 of them already, because after a certain period, the antibodies decline. Okay, so it's important that you get the booster dose. And in one of our webinars by Dr. Marisha Recto, she mentioned that there is an important time interval, because getting the booster too early, you might hinder the T cell response. So it's important to get it at a certain time, relative like 3 or 4 months. Some believe 3 months, some believe 4 months after your primary series. And the boosters give additional protection. Now, the combination of efforts contribute to the current low incidence of SARS-CoV-2 in the country today. So, if you look at the daily numbers of DOH, the numbers are really way down, no? And we have to be thankful for that, no? That most, not all have been vaccinated, but as a good number of our citizens are already vaccinated. So, what is the significance of her study? So it gives us a better understanding of vaccine effectiveness. We can use this information in modeling, and it can guide policy, and it can translate to better care of our people and contributing to the end of this pandemic. Okay, so it's very important that we take note of all these. Now, from Dr. Jubert Benedicto, he pointed out that there is still vaccine hesitancy at this time. We are already like 2 years into the pandemic, and still some are still hesitant to have the vaccine. The vaccine is very effective in preventing death and severe form of COVID. Now remember that COVID, even if you got well from the COVID infection, you can have the long COVID or the post-COVID, and that can last for several months. No? And so he mentioned that there is a vulnerable population. So who are the vulnerable population? The elderly, the immunocompromised, those with comorbidities like diabetes and hypertension, and also those with cancer, and those undergoing dialysis. They are the vulnerable population. And in the vulnerable population, if they are unvaccinated, there is the possibility of be getting to have critical or even death in this patient. So we have to get vaccinated and the booster. So when you are unvaccinated, he said that you are can be a possible carrier of the COVID-19 virus. And that is such a sad part, because you might bring it home with you here home. So who gets the booster at this time? As mentioned, those who are immunocompromised, healthcare workers, the elderly, they are the ones who would benefit most. But getting the booster for all of us is, I think, and also what they also said, the better course of action, the best course of action. And remember that long COVID is a reality, and the best way not to get long COVID is not to get COVID in the first place. Okay, so I'm glad that I was part of the study of Nina BERBA in getting the antibody level, and I was also part of the group who has not yet had COVID. Okay, so from Dr. Albert Domingo, he said that the NCR, so he's the voice of DOH in this program, the NCR maintains a steep increase in the reported cases, but the remaining areas also show increase in cases, but they remain less than 1,000. See that the cases even though they're going up, but the numbers are still manageable. The number of severe and critical cases remain less than 1,000 despite the continuous case increase. And he mentioned, and this was also mentioned in previous webinars, PDITR. P stands for prevention of COVID, D is detection, I is to isolate so that you will not transmit it to others, T is to treat the infection, and R to reintegrate. But he said that there is a fourth letter which is lacking, and V, that is V, to vaccinate. Okay, so he said he has this nice picture, the wall of immunity. When you get vaccinated, you form that wall of immunity for your family, for your mother, father, your sisters, and those who have who are immunocompromised. And this wall protect them from getting COVID. So to have that wall, you should be fully vaccinated and should have been boosted. Thank you very much for listening. Back to you, Susie.
Okay, thank you very much. That's Dr. Stella Jose, Assistant Director for the Philippine General Hospital. So, very interesting today, but more interesting next week. Nako, natumbok natin yung mainit na topic. We will talk about boosters next week, and we are going to have none other than the chair of HTAC, who will be talking about the science behind recommending first and second COVID-19 boosters. And I'm sure it will be a very, very exciting discussion. We are looking forward to your participation. Tsaka siguro, imbitahin niyo yung ibang mga health workers makinig, no? Kasi katulad nga ng sabi ni Albert, parang 1/3 lang ng mga health workers natin ang boosted. So, kailangan mag-start, it has to start among us, because we are the ones who are able to convince also the families to get their vulnerable and priority members boosted, and ultimately for everyone to be boosted. Okay, over to you, Raymond.
Thank you. Thank you for the excellent recap, Dr. Stella. Thank you, Dr. Susie. So, yun po, no? Abangan nyo po yung next week po natin. Talagang, if you have any questions lalo patungkol sa boosters, we will be very much open to take those questions. But before we conclude our program, we'd like to acknowledge the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we won't be able to churn out quality content week in and week out. We also know that everyone is very busy. So kung ano po, no, if you have the time, we have all of these very, very short and consumable po na mga videos which we call SCD shorts. They are also here in the YouTube channel po, youtube.com/TVUPPH. All of our webinars are archived there from 1 to 105. And also, after this webinar po, magiging 106 na po siya. So, lahat-lahat po yan ay makikita po dito. Just go to youtube.com/TVUPPH. This formally closes po our webinar for this week. We hope to be able to see you next week po. No? Although, baka ako naman po ang baka mawala next week. So, Dr. Susie will have a new partner on air at least for the next webinar po. No? Magkita-kita po tayo ulit next week during our regular Friday from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online!